We're going to talk a bit this morning to anyone watching who might be experiencing some knee pain and considering getting a knee replacement. Before you do that, listen to our next guest. Dr. Martin Redish is on the show with us this morning. He is with Parkridge Bone and Joint, and he and I are having a bit of a reunion actually this morning, because you're in my workplace this morning, but a few years back, I had a chance to go and see you at Parkridge. Good to see you.
It's good to see you without the scrub hat and everything. But we did a very nice presentation of partial knees. What was it, 8 or 9 years ago?
Yeah, and you just got people's attention because I just said knee replacement, and then here you mentioned the word partial knee. That's kind of the bell ringer this morning, is that people don't always have to have a total knee replacement.
Right, so at least half of the people that have a total knee replacement, and I'm sure your viewers know people that have had them or their parents. It's a very common operation. It's a tough thing to go through, and half of these people don't need them if they're just aware that there's an option of minimally invasive partial knee. And that's why I'm here to let people know.
I know you're going to give us a show and tell, but I want to go back to that first visit that you and I had those 8 or 9 years ago, where we went to the hospital with you. And we went into the OR, and there was not a real patient, but we simulated one.
Right.
And it was fascinating to watch how you did this. And that video, I never knew this until my conversation recently, was uploaded on YouTube, and you get people coming to you now from all over the world who are seeking your knowledge.
That's right. No, that was a great video. They love the sawing the bones and showing the procedure. There's nothing else like that on YouTube. So of partial knee videos, it's more than doubled any other, the second place one that's viewed as far as partial knees. So they really love that video, and that's what's gotten people from all over the country and North America to come and have partial knee.
If you are experiencing the kind of pain that makes you even consider getting a knee surgery, it's pretty debilitating probably. So people are going to be begging for relief where they can find it. When they come to you, the first thing you're going to do though is x-ray them. Is that right?
That's right. And we're going to show that x-ray. And let's just imagine that you're the patient.
Yeah.
And your knee's been hurting you for a couple of years. It seems to hurt, say, just on the inside part of your knee. And it's getting to the point where you can't walk for exercise. Going to the grocery store is difficult. You're leaning on the shopping cart. And you've come and you've tried every cortisone shot and everything. It's time for surgery.
Right.
And I'm going to act like you're the patient and show you the same options that I tell them. They have two options.
Okay.
Total knee replacement or a partial knee. A total knee looks like this, and if I could borrow your
You can borrow my
for
knee.
just a second, the incision would be from about here to here.
Oh, I'm going to put my, hold on. Show that again.
From about here to here.
That's a long incision.
That's a long incision. You have to cut through your quadriceps muscle all the way around your kneecap so that we can take the kneecap, flip it upside down, dislocate it out of the way, so that the end of this bone sticks out, so we can saw off the end of the bone, like we did on the demonstration.
Sounds lovely.
And put that over the end of your bone.
So then this is going to become my new kneecap.
That's going to be cover the entire end of the bone.
Okay.
Then we'll saw off the top of this bone, the tibia, put a metal plate on there. When we do that, we're removing your ACL and PCL, which are
removing it.
Yeah, they're gone with a total knee. And we snap lock a piece of plastic in, and we put a plastic button underneath the kneecap, which is sitting upside down. Then we flip it all back over, stitch it up, and
there I go.
And yeah, there you go.
Now, what if I said, oh, please, I don't want that. I want
Well, you've
partial.
got the other option, because your knee is only worn out on one side, and it's over here. So here we could, with a minimally invasive partial knee, make an incision like this. Okay, so we're not cutting through muscle. We're not flipping the kneecap over.
Okay.
We're not sawing off the end of the bone. I'm sneaking in here with a high-speed burr.
So you've gone from this to this to
that.
this.
Right.
Okay.
And the important thing is not cutting through muscle, not flipping the kneecap over, just inlaying a piece of plastic in the one side, and this is the piece that we put in.
Much smaller. Look at the comparison.
Compare those two.
I don't want to mess up your prop. Wow, look at the difference. Does this also help you from a stability standpoint?
It helps you from a stability standpoint because your ACL and PCL are retained. So we don't remove your ligaments. We don't cut through the muscle. We leave 2/3 of your knee natural. So we talk about staying strong because we're not cutting the muscle, staying stable because we're preserving your ligaments, and staying natural because the rest of your knee is natural. We can't improve upon that.
Okay, you said something that probably is important, and that is that we're going under the assumption that I only have one side of my knee that is problematic.
That's right, but that's a very common thing. So that's at least 50% of people are in that situation.
And the example you gave to me, the difficulty was on the inside of my knee. What if the problem area is outside?
85% of the people have a partial knee on this side, and 15% have an incision like that on the other side.
So if you are the 15%, could you still take advantage of it?
Absolutely.
Okay, now I mentioned the YouTube video and the worldwide attraction that you're getting from patients, but you're also such a believer in what you do that you're kind of taking your own message out. You're teaching a lot of other surgeons about this, right?
Right, and we plan to do that a lot more later this year with a new improved product coming out where we're really going to put a lot of effort into teaching other people to do this, because people shouldn't have to travel all the way to Chattanooga. They should have someone locally. Unfortunately, most orthopedic surgeons don't do partial knees. They don't like doing partial knees. They don't do this minimally invasive type. They do a partial knee that looks like half of a total knee. See, so.
Yeah.
And they take a lot of bone out, and if it doesn't work out, it's difficult to do anything.
I wish that you and I had more time, but we don't for this morning, but we've at least gotten people enough to know to do their own research. So 2 points to make to you. Here's how you can find Dr. Redish. He's at Parkridge Bone and Joint. You can call and make your own appointment. No need to go through anybody else. 493-5220, and then there is their website. If you're interested in this video that we did for a longer format, if you Google partial knee versus total knee,
that's right,
you'll find it, and you'll be among 700,000 other people who've watched it. So
that's right.
Great to see you this morning.
Nice to see you again.
Thanks.